We starting? Starting now?
Yes, please.
Okay, thank you everybody for joining us for today's forum and this important conversation. We've all seen the terrible rise in the number of people living on the streets in Los Angeles. Headlines and papers from San Diego to Eureka and everywhere in between raise the issue. In Los Angeles and in Sacramento, the state, city, and the county have adopted comprehensive plans to try and respond to the crisis, yet it seems to just get worse, not better. As leadership of Jewish Family Service of Los Angeles, we want to better understand the problem and be part of the solution. Many of you were at our board installation dinner when I shared my interest in exploring the role of JFS in serving people without stable housing. This afternoon's program is part of that discussion and hopefully will be the beginning of an ongoing dialogue with our leadership, partners, and staff about how JFS fits into the conversation. We've brought together two panels to share their and our expertise with all of you. First, we will be joined, sorry about that. First, we will be joined by external partners who are experts in the field and with whom we are fortunate to work. After that, we'll hear from several JFS staff whose programs provide resources to people of all ages experiencing homelessness. These programs and services help prevent homelessness and restore clients to stability and advance policies that protect JFS clients who are experiencing or at risk of homelessness. Thank you all for joining us today. And I'd like to now introduce and turn it over to our President and CEO, Eli Weitzer.
Thank you, Randy. Today, we all hope to learn about the economic and other drivers of homelessness, how housing and other policies impact vulnerable older adults and survivors of intimate partner violence who are housing insecure, and about what efforts are underway in LA County to reduce the number of people experiencing homelessness on a daily basis. According to the Department of Housing and Urban Development, on any given night, over 500,000 people in the US are without a home. Unfortunately, more than 1 in 5 people experiencing homelessness in the US live in California. Some reports suggest that California has more than 1/3 of the nation's chronically homeless, those with mental illness or other significant problems, and an even higher percentage among homeless women. Many smart, passionate individuals are committed to finding solutions to this economic, moral, and public health crisis. This afternoon, we hope to start a conversation around how we as a community address this overwhelming problem. Following remarks from each of our distinguished experts, we will open up for questions from all of you. Please type your questions into the Q&A box or click the raise your hand button after the panel concludes. Before we dive in, I do want to say a couple of thank yous. First, to our panelists for taking the time today to share their expertise with us. We truly appreciate it. I also want to thank our own program leadership, Karen, Jessica, Jen, and Steve, who will be speaking later, and Valerie and Davina, who are working behind the scenes. And I want to say a very special thanks to Nancy Volper, who has really put together today's event. We are fortunate to have a longtime friend of JFS and a true leader in the field, Wendy Gruel, with us to moderate our panel. For those of you who don't know her incredible background, Wendy has an extensive career in public service that began when she worked with her mentor, former Mayor Tom Bradley. Wendy was elected to the Los Angeles City Council, proudly serving the San Fernando Valley, and was later elected as LA City Controller. She currently chairs the Los Angeles Homeless Services Authority Commission and served in President Clinton's administration as the Deputy Director of the Interagency Council on Homelessness and the Southern California Regional Director at the Department of Housing and Urban Development. She also currently serves as co-chair of the LAUSD Task Force, as a member of the Women and Girls Initiative Governing Council, and on the boards of Emily's List, Emerge California, East Valley YMCA, Oakwood School, Discovery Cube LA, Planned Parenthood Advocacy Project, CAUSE, Abode, Homeland Security Advisory Council, UCLA Luskin Advisory Board, and on the LA Kings Business Advisory Board. It is my pleasure to welcome Wendy Gruel to today's gathering.
Eli, thank you so much for that introduction. And I don't know if I feel tired or old when you mention all of those things, but thank you very much, and have enjoyed my relationship with JFS and all that you do, and I appreciate it so much. And glad to be here today with some of my friends and colleagues who are on the front lines of addressing homelessness. So thank you so very much. And really today, we want to be able to look at a variety of areas, and you have some of the best experts and one of my colleagues on LASA who is going to be able to give you a little bit of understanding of things. And so I want to just tell you some of the questions and things we might look at, and then a little bit of where we are on the issue of homelessness, kind of the context of where we are. So as you all know, this is like the #1 issue in Los Angeles. It's the #1 issue for politicos. It's a #1 issue for people in their communities. It's the #1 issue to all of us who care about making sure we don't have people living on the streets. And it is a unique time after COVID, post-COVID, although horrible time for a variety of reasons, there are some silver linings, I think, for us in the world of serving the homeless, is the fact that people stepped up to the plate. We learned some really critical lessons. We chopped off some bureaucracy that was causing us trouble to get some of the facilities, and it really has educated and made people aware of what has been happening. And currently, some of the key issues as part of that is, who are the homeless? How do we address it? Is there one thing you can do that's going to solve homelessness? I can tell you the answer for that. All of us will be no, there's not just one answer. But we had some challenges during COVID. We had to demobilize and decompress many of our facilities that normally would have been able to house more. But we had Project Room Key and Project Home Key that was successful. And I think we saw the rental market and how that was affected. And we saw a number of issues relative to mental illness, and obviously an increase in that. We saw also engagement at a federal, state, and local level, unlike any other time in our history, and ability to bring funds and attention. And as we speak today, the last day of the legislature, there are a number of housing and homeless bills that are being considered, and crossing our fingers that those that are going to be helpful to us get passed today and signed by the governor within the next month. Just almost literally, I think a week from now, or a little over a week from now, we will release the homeless count. And that is going to give us a little bit of a snapshot. It is not, it's a point in time. It is one day, but it does give us an idea of things that we'll be able to do. And for example, just a few years ago, Amy Turk and I got to work together when there was a huge increase in homelessness. Women on the streets. We set up a task force to look at and study how we could do a better job. And I think the same, we also, when we look at the number of African Americans and we look at the number of Latinos that are there, it really is a critical issue. So it is a good time, and JFS is, of course, at the forefront here, helping people be educated and aware of what it is we want to be able to do. So, some of the questions that we're going to ask is, what are the most successful approaches in reducing homelessness? What are some of the current legislative proposals that are looking at homelessness? What type of people are experiencing homelessness? And what are some of the reasons that led to that? And one of the issues which has been talked about is governance. Who's in charge? How should that be? Is there one model? Is there a variety? Which local officials are the most responsible for this? Or how do we have a partnership there, and what's the system? And so I'm really looking forward to this discussion. So we are joined by 3 amazing panelists, and I want to make sure I don't forget any of the notes. I hope that you will put questions in the chat so that if you have questions, we make sure that it is addressed during our time together. So I want to be able to briefly introduce our first is Carter. And Carter, I always know you as Carter in your best way to pronounce your last name, because it sounds like Hughley. Okay, I said it right. I just know you as Carter for all these years.
It's fine. Carter works.
It's kind of like Madonna, Carter. So Director of Homeless Initiatives at United Way of Greater LA. He leads the Home for Good initiative, working to build evidence-based resource and strategic coalition to end homelessness. Has really been a fabulous strategic advisor here in LA County. He's the former senior advisor at the DC Department of Human Services, where he oversaw efforts to increase permanent housing exits, expand daytime service centers, launch shelter diversion programs, implement harm reduction and low barrier shelters, and strategically transition the family system away from a motel sheltering model. In addition to his role at United Way, he is an adjunct professor of applied analytics at JHU. He holds a master's of public administration from the Maxwell School of Citizenship and Public Affairs at Syracuse, and received both a BS in economics and a BA in public administration from Miami University. We have Jean Galena, who is my colleague at LASA, Older Adult Systems Coordinator for LASA. She is a mission-driven gerontologist focused on designing and implementing strategies based on age, ability, and racial equity to improve programs of prevention and housing for older adults. She has designed successfully supported programs that fill some of those gaps in braiding the services together from traditional and non-traditional partnerships to address the unique needs of LA County's most vulnerable, our older adults. She's a proud member of the California Community Access Foundation. She holds a BA from Lehman College and a Master's of Aging Services Management degree from the USC Leonard Davis School of Gerontology. So welcome as well, Jean. And last but not least, Amy, who I feel like I've been on the front line so many times together, who is the CEO of the Downtown Women's Center, is a licensed clinical social worker and has held leadership positions in the field of social work and homelessness since 2001. Amy began her tenure at the Downtown Women's Center in 2013 as the Chief Program Officer, while she administered all of the programs and social enterprise. In 2018, she served as the Chief Innovation Officer in the development and leadership of implementation of new programs, organizational projects. And she was appointed, thank goodness, to the CEO in early 2020 and has grown revenue. I was happy to see this by 30%, created a new 3-year strategic plan, and is deepening DWC's focus on social justice. She holds a bachelor's degree in sociology from Pepperdine and a master's degree in social work from Cal State LA. So we're so happy to have each of you, and we could probably take the whole hour by just that, but we're going to ask each of them to say a few words, and then we are going to open it up for further questions on that. And I have some questions I want to be able to ask. So Carter Hughley, now that I can send it correctly. Carter, welcome. And if you could just give us a little bit of words of wisdom from United Way, who have played a really critical role in Los Angeles in being a coalition builder and a leader.
Well, thank you, Wendy. It's an honor to be here with you and with everyone else on this call. You know, we get asked a lot, you know, how's homelessness going, and, you know, is it moving in the right direction or the wrong direction? And one of my reflections is that, you know, it's always been at an unacceptable level. It's a terrifying and dangerous situation for anyone who experiences it. And whether the homeless count releases that it goes up or down, I think that what is true from my perspective is that we are getting better at understanding it. People may think it's more visible, and in a lot of ways it is more visible because people are waking up to the dangers of congregate shelters and how easy it is to transmit communicable diseases in congregate shelters. It's rare that it happens to people, but it is still too common because affordable housing is less and less common, and incomes are at the lowest levels, or incomes at the lowest levels are just not keeping pace with rent. It is more dangerous on the streets than it used to be because those who do struggle with addiction are navigating more addictive and lethal substances with meth and fentanyl in the drug supply. So our neighbors who struggle with addiction are facing more daunting situations. And too many of our neighbors who have access and functional needs are frankly sort of left out of the system and are being left to fend for themselves outside. So what you're experiencing and observing is a situation that no matter what the pit count says is already hard, has always been hard, and is in some ways getting harder. But the good news is that the scale of our response, though late, is taking shape. And I have the unique role of sort of staring at a lot of these numbers and this data. And so I just want to always take time to remind folks that, you know, there is hope, because almost 80,000 people have been connected to permanent housing since we passed Measure H. And that's a scale of a response that would not have been possible without Measure H. 36% more people are getting into rapid rehousing than ever, and they're getting in faster into that program than ever before. We have provided interim housing to 104,000 people since we passed Measure H. We've engaged almost 60,000 people in outreach since 2017. That's an increase of 25% each year between 2017 and 2021. You know, prior to Measure H, LA County was only reaching about 5,000 individuals a year. So we have drastically increased the scale of our ability to respond to this crisis. Outreach is now available 7 days a week. And there's a multidisciplinary team, an outreach team in every spa 7 days a week. We got 7,000, almost 7,000 emergency housing vouchers in the American Rescue Plan. We've issued almost 5,000. And I know only 1,000 are leased up, but we've gotten, you know, way more than that connected into that pipeline. So I'm really hopeful that we'll be able to use up all of those 7,000 emergency housing vouchers before we lose them. Proposition Triple H has already yielded about 1,700 units and is the pipeline to deliver 6,300 more will happen over the next few years. That's more housing in the last few years than I think we've produced in the last 30. And on average, 85% of the homeless prevention clients that we work with don't return to homelessness within 12 months. And those who received financial assistance returned even less frequently. So there's a lot of challenges, there's a lot of devastation, there's a lot of humanitarian crisis on our streets. You all know that. But I think what I know that not everyone does is that there's also a lot of progress. And the progress is pretty recent if you zoom out. So as Wendy mentioned, some of the challenges that we have that I think everybody should know about, this resolving our governance questions of who's in charge and who's accountable. We really need the Board of Supervisors to resolve those lingering questions of governance so we can move beyond those questions and really marshal all the county, state, and federal resources to end this crisis. We do have to disrupt the status quo, but we have to do so without starting from scratch. You know, our zeal for change has to coincide with practical and expeditious solutions at scale and leveraging the good stuff that we've already built. So we can't throw the baby out with the bathwater because there's a lot of good foundations that have been laid with Measure H already. We've got to renew Measure H. A lot of the results that I just talked about are only possible because the voters have voted through Proposition Triple H and through Measure H to tax themselves and raise revenues to build more housing. But that Measure H tax expires in 2027. We've got to pass a replacement funding source in 2024. Otherwise, by that time, we'll be pulling the rug out from under about 25,000 formerly homeless individuals who've been successfully placed in permanent supportive housing. Housing is the answer. You know, the evidence shows us that, you know, communities have similar levels of mental illness, similar levels of addiction, but the homelessness really goes up when you have no affordable housing. And so we today are waiting to see whether SB 679 will pass to create a local housing finance agency that has a credible shot at protecting the affordable housing we have and buying the properties and land to expand our affordable housing supply. It's right on the razor's edge. It might have passed or failed while I'm speaking. But there are very credible proposals to sort of think about how do we bring more housing to scale. But one issue that I have a unique lens on that I also want to raise that I know this organization, I'm certain spends a lot of time thinking about is the capacity of our workforce. This work is not possible without the resources, yes, but it's also not possible without a workforce that is all too often underappreciated and underpaid for the nearly impossible work that they do. And the capacity of our nonprofit partners is extremely tenuous. We have lost 30% of our sector in the last year. Those that remain have only been here for, majority have only been here for about 2 years. And that's the time window with which most people do leave. And so we don't have a hugely strong foundation in this sector of longevity. We've got a lot of new people who don't have great training programs and manuals that tell you how to do this really impossible work. And so we've really got to bring in more talent. We've got to retain the talent we have. We've got to attract more individuals that are in the Gen Z population. We're not tapping that talent nearly enough. We're not tapping people with expertise enough. And we're not building the career paths, especially for our Black, Indigenous, and people of color into executive leadership positions. We've really got to focus on making sure that they see clear pathways to leadership, that we change our culture from a trial by fire culture to a peer learning culture, that we're tailoring our benefits to our workforce, improving our technology, and making sure that our employees feel mentally and physically safe at work. There's a lot of workforce capacity issues. We can't pull this work off without a strong workforce that believes that they are safe, protected, and rewarded and compensated for the work that they're doing. But because of the work that I do and the seat that I get to, the role that I get to play, I get to see all the evidence of their success, and it is remarkable. We're not there yet, but we are well on our way, and I'm really excited about the work that we are all going to do together, particularly around older adults, which I know Jean will talk about, and those who've been victims of intimate partner violence. So I'm eager to hear what my colleagues have to share, and appreciate the time that you all have afforded us today, and happy to answer any questions you have.
Thank you, Carter. And so just kind of a great laying out that foundation of the kind of, where we are. And you're right, we rarely celebrate the success part of it, and again, I know I can, before I introduce Jean, from the LASA perspective, we always feel like there's always the criticisms, of what has or has not happened versus we really have achieved a lot. We always can improve. Can you just real quickly for me, because I think there's a lot of, I don't know, misinformation or non-understanding of what housing first means, and because we went from, and you probably remember this historically, and when I was in HUD, which was of course, decades ago, it feels like, which it was, where it was, you had shelter, transitional housing, permanent housing. And then for a very long time, there was no transitional housing, and it was go to right permanent supportive housing because of housing first. And I think we've, everyone has evolved, as you've said, throughout this. And some solutions worked 5 years ago, don't work today, or vice versa. But, a lot of people say, why can't we just get people off the street? So could you share just real quick a definition, your professorial kind of a definition of housing first?
Yeah, I mean, I think of it as housing without preconditions, that the first and most important thing we need to do is to get you housed. And that any supports that you need, it doesn't mean housing only, but it does mean let's do that first. Let's get you inside, let's get you safe. And any additional issues you have, whether it's addiction, mental illness, chronic health conditions that are underdiagnosed or undertreated, we'll work on that. But all of that is easier worked on when you're housed. And we don't need you to be sober first, and we don't need you to be employed first, and we don't need you to have a totally clean criminal background. We need you to be inside, and in a place that is safe and comfortable for you. That's what I understand housing first to be. Housing without preconditions. And the old model is sort of like a lot of rules you gotta meet before we'll let you in. And I think that the housing first philosophy is no, let's get you inside first, and then that's going to make everything else a lot easier.
Absolutely. Thank you very much. And I'll ask, Amy may be able to comment a little bit further on that too. And it was kind of the rub sometimes even with Project Room Key it was in many ways housing first, although there were some rules that people didn't like. But generally, the idea was we could find people, instead of having to find them in an encampment, we could find them at that Room Key site and be able then to find, okay, they need an ID, they need all these things. And we knew tomorrow they're going to be at that same place, versus we could show up at that encampment and they might've moved or gone or not there, wherever they may be. So there were some unique opportunities there, as I indicated earlier. Thank you again, Carter. We will come back to you. Jean, happy to have you again, and give us a little bit of insight into the older Americans and your kind of your focus that you've done there at LASA.
Thank you, Wendy, and thank you all for having me here today. I'm really excited to talk about older adults all the time. I thought I'd just maybe give a little background, a little context of older adult homelessness. As you all know, our homeless count data from this year has not been released, sadly. So the data that I'll be citing, of course, as we know, it is just the homeless count, so it's approximate data. But as predicted by researchers all over the country, older adult homelessness is predicted to grow steadily up until 2030. So we've got really a problem facing us, and that was reflected from 2017 until 2020 in our homeless count data, where older adult homelessness, meaning clients who are 55 and older, increased by 20% in just those 3 years. And we're all kind of shaking in our shoes for what we're going to learn from this year's homeless count data. That means just 14,900 people who are 55 plus are homeless on the streets of Los Angeles. And one thing about this population that we should always keep in mind is approximately 40% of them are African American and 25% are Hispanic. So we're talking about 65%. So these clients are overrepresented as compared to our population, our regular population. And sadly, that disparity increases with age. So at 55, it might be, 70%. At 65, that number raises. So it's really a big issue of equity, not in just the drivers of homelessness, but those who we see who are unhoused. And one other heartbreaking thing about our older adult homeless clients is that they are experiencing geriatric conditions that are equal to their housed people who are anywhere from 10 to 30 years older, meaning that the bodies age rapidly when they're homeless. So what we see in our homeless older adult population is they're living with a lot of disability. They're living with a lot of multiple chronic conditions that are often not treated or maintained as they should be, which of course lead to more and more issues. But also we have a lot of our clients who need assistance with their activities of daily living. They need help showering, they need help getting around. And this population is really a challenge to house because they need services in their housing. And it's always been a challenge for all systems. But when we think of it as age equity, we think of it as racial equity, and we think of it as ability equity when we are talking about older adult homelessness. That's what I like to refer to as the trifecta of equity. Some good things are happening here in Los Angeles, most especially around our older adult population, is that we've got some really interesting non-traditional partners jumping in to help. Which was unforeseen and really thrilling. The Scan Health Plan has several different arms. They've got their Independence at Home homeless arm. They've got their street medicine. It's called Healthcare in Action, which is really exciting. They're coming out sometimes to evaluate our clients either on the street or who are in some of our PRK sites. And then we have a really exciting opportunity basically with the Scan Health Plan, where they're going to be providing their fully integrated dual eligible healthcare support to clients in our permanent supportive housing. So those are clients who are otherwise nursing home eligible and otherwise very difficult for us to find appropriate and safe housing for. So this is really thrilling. We also have the program of all-inclusive care for the elderly stepping in. They're also at one of our newer, soon to open, actually, or just open site for older adults. Where they're going to be coming in and they will be serving also nursing home eligible clients in their own rooms throughout their entire lifetime. Both of those programs, you don't get shipped off into a skilled nursing facility when you become weaker. You get to live your life out in your home like most older adults really prefer. And I won't keep talking too long, but I did want to also note that the new CalAIM, our insurance, it has a real focus on homelessness and a huge focus on older adults. And one of those things that's super exciting, there's so much that's exciting about it, but one of those things is it's bringing in managed care plans and getting them more involved with their homeless clients. We're not sure, exactly where it's going to go, but it's very exciting and it's promising. So I'll end on that happy note.
Great, thank you so much, Jean. And we will come back to you with some questions. I do encourage everyone, if they are listening, someone did put a question in the chat, so please add questions and I am taking note of them so I can ensure we ask the panelists to do that. Amy, tell us what you've been able to do for women, and particularly we saw older women, the number of older women growing with the Downtown Women's Center as well.
Yeah. So nice to be together. I have a special place in my heart for Jewish Family Service that helped me on my clinical licensure path. I was an intern, I think, in 2006 in the Hammer Cause program under Amy Bryman and with Sarah Blitzstein. So keep in touch with them and just really had a fantastic experience and growth opportunity with you all there. I think emphasizing what my colleagues have already implied, if not said directly, that there's just not one solution to homelessness. It's really a kind of triage the need and direct people where they need to go, just like we do in our healthcare system. And I wish there was one blanket solution that we could apply, but it's just so intersectional with people that are unhoused. You know, they bring many intersections to this work, and where I spend most of my time is in the intersections of race, gender, and of course, housing instability and gender-based violence. And what I see in the population that we serve at Downtown Women's Center, we work with over 5,000 female identifying individuals and some families, some kids every year. But across Los Angeles County, a little over 20,000 of our unhoused neighbors are women. And that's about 30%, and a number that grew 17% from the previous homeless count, so from 2019 to 2020. So unfortunately, women are a growing population, and why we see some of the drivers that are similar to all experiencing homelessness, of course, is, you know, rooted in America's unique display of racism and its impacts, in particular, you know, in accessing where people can access affordable housing, where people can access healthcare, education, and such. For women, of course, there's a huge likelihood that they've experienced childhood abuse, carried into domestic violence and interpersonal violence experience as adults, sexual assault, both before homeless, of course, more vulnerable to that while unhoused, trafficking, stalking. And for those reasons, we really implement a trauma-informed model in all of the work that we do. And also for women, just seeing a huge wealth gap. Of course, more pronounced for women of color, but that's one reason why we see so many older adults. And again, to Jean's point, older means 50, 55 and above, because of the geriatric health conditions that seem to follow that population. But so for that reason, for the wealth gap reason, we tend to work with women who are not seeking homeless services within a family unit. A majority do have children who are adults and on their own, or in the care of another system or family member. So that's kind of the unique reasons that women experience homelessness, but then we learn a lot about what they need. Downtown Women's Center, since 2001, every 3 years, goes out and talks to women who are unhoused and really listens to exactly what they express that they need. We're in the middle of our 8th report, which has scaled countywide. So we are seeking to survey about 700 women across the county. To inform the survey, we did countywide listening sessions with 91 women. The top need expressed was that of wanting to feel dignified. As a person, walking around town, in programs, in seeking for help, a lot of that was tied to lack of access to hygiene, and you know, unable to have a dignified way of taking care of your hygiene, which resulted in people not taking advantage of opportunities, not seeking doctor's appointments, not seeking discussions with families or reconnection with family, or seeking employment because they didn't have simple access to just hygiene needs. So that's one example of how we lift up the actual needs of women. And of course, they always express how hard it is to find permanent and affordable housing. What was also really unique in our most recent round of listening was how people supported each other in each listening session, and how important peer support is in our work, and how we can create environments that foster that peer support for each other. And of course, at this intersection of domestic violence, you know, we've done some work with Nancy and with your team in the creation of the Domestic Violence Homeless Services Coalition, a coalition that's now grown to 250 organizations. About 800 people are on the listserv, and we've been at work for the last 5 years to try to decrease the silo between our traditional domestic violence services and our traditional homeless services, noting that there's strengths in both sides. On the DV side, we have been long experts in trauma-informed care and appropriate trauma intervention. And on the homeless services side, we've been long experts in what it takes to get people permanently housed. So we've been doing a lot of cross training and support because we are working with the same people, both literally or people that are bringing the same issues into recovery. We've done a lot of policy work together. We've advocated for new funding. I feel that we are all responsible for bringing in a lot of new, in particular, rapid rehousing dollars to support domestic violence survivors. And that our voice had an influence in the new HUD emergency housing vouchers that Carter mentioned being prioritized for domestic violence survivors. I'll add some comments, my comments there for now.
Great, thank you so much, Amy. And again, to our audience, if you have questions, please send them in the chat. Amy, just to build on one of the comments that you just said and about domestic violence, there was a lot of fear during COVID that women were in essence stuck at home sometimes in a volatile situation, and that we would either see more individuals, women who were seeking shelter, or that once everything started to open up, we'd see an increase then. Have there been any trends? And I would say, Carter, if you want to add anything to what you've seen on that as well.
Yeah, I mean, the first part was like sort of a dip in calls for help because people were, quote, safer at home and couldn't make phone calls for help. And then we saw those hotline numbers start to increase. And thankfully, our city responded with creating its own hotel program called Project Safe Haven. While on the homeless side, we set up the Project Room Key FEMA response. The domestic violence providers doubled the amount of shelter beds they had with 3,000 hotel beds throughout the duration of the program. And they were all full. So you can tell that like the need was certainly there. We didn't want the program to go away, but the funding mostly went away. But yeah, in any huge, economic crisis, global disaster, you see an increase in interpersonal violence and domestic violence.
Again, go ahead, Carter.
Oh, the only thing I was going to add, just generally, if I zoom out beyond intimate partner violence, is, for many populations, it takes a while for the hardship to result in homelessness. Like people usually exhaust family, friendships, lots of emergency temporary situations in hotel rooms. And so I think one of the things we're keeping our eye on is we might not have seen the inflows into homelessness yet that I think a lot of us feared, but that inflow is not yet due. I think a lot of us are thinking like 2023 is when a lot of those familial connections, friendship connections, a lot of that generosity among your support network might have reached its limit, and that you might then be out of options. And so I think a lot of us are looking at the couple of years out from now as when we need to be keeping our eye on some of the inflow that might be resulting from the pandemic.
To build upon that, then I'm going to go to Jean in a minute, but to build upon that on prevention, always we have and you gave some wonderful statistics when we released the data of the point in time homeless count, we find that it's always, we have served more homeless people than we've ever served before, housed more, done more, measure H, and then people go, yeah, but wait a minute, I still see them on the street, I still all that, and that we talk about prevention, the role of prevention. And there were some during preventive kinds of things that happened during COVID, and rent relief and a variety of ways in which to do that, but eviction issues, et cetera. How important it is in your kind of study and what you looked at is the prevention side of that,
Huge.
Yeah.
Huge. I think there's macro prevention, which is I think we're going to see when we see the results. Like it obviously helps. Like those rental protections, those macro interventions obviously prevented a lot of people from losing their housing very quickly. And so from that side, I think it's really clear that the situation could have gotten a lot worse than it did get because we put a lot of macro interventions in place. On the micro interventions at the household level, I think there's a lot of really good evidence that when we can do it, it works, but we're not doing it at scale yet. And we're not doing it with our mainstream systems. Like, and what I mean by that is we're pretty good at paying the rental debt once you get to, once you tell us like, hey, I've had an eviction filed against me, we can get you into the program and pay those arrears. But it shouldn't take the person to get to that point. If they're already someone who's in the county system, they are known to our DPSS team, and they've struggled with housing stability in the past. So I think we're not yet as good at upstream prevention at the household level, using all of the arsenal that the county has with our social safety net to be able to really prevent households from even becoming housing unstable to begin with.
Great, thank you.
There's some really exciting work, I won't go into it, or that the county is doing now on targeted prevention, really using data science to figure out like who might who might be homeless. And there's some really good results from that, but it's very early, so can't take it to the bank yet, but very excited about some of the movement there.
I'm going to come back to you in a minute in the and just to talk about the Vida Spadat, I can never say that right either, you know, and how we looked at the most, you know, vulnerable and the, you know, acuity, and if that, you know, even if we need to look at changing that, but I'm going to come back to that because I'm going to go to you, Jean. And, you know, one of the questions in the chat was about board and care facilities. And I think I saw it kind of in two ways. I think that the individual who wrote it was about, are we seeing more elderly, you know, homeless because there's a lot of these care facilities closing, or as I saw it as an opportunity potentially for some of those sites, and people have talked about that are closing, because again, it's not as it was in the old days that's where you know, someone actually went to and spent, you know, many of their last years there. It's just changing in the various options that you have. So I would ask you on kind of both sides. Are the closing of those some cause of some people becoming homelessness? And two, are there opportunities with vacant board and care facilities to utilize them for the purposes of helping individuals who are homeless?
Yeah, I'm not convinced that the reduction in board and cares is driving the rates of homelessness. I don't believe that that is the case, although I could definitely be wrong. I know that board and cares are a big focus of the state to try to support them, technical assistance, financial assistance to keep them open, because they are a critical housing source for our older adults who need supports, like those who need supports with the activities of daily living. It would be a dream come true if everyone that closed was open for older adults who are at risk of or currently experiencing homelessness. But right now we're working on potentially developing programs where we work with a couple of our older adult anchor organizations, Huntington Senior Care Network and Partners in Care Foundation, to link our at-risk or homeless older adults with an assisted living waiver, and have those organizations help place those clients into residential care facilities for the elderly or other assisted living opportunities. We have our first in process right now of a 90-year-old gentleman who is actually being evicted tomorrow. He's not going to be homeless. We have the wonderful Home Safe program, which is a wonderful prevention program, and a program now as of Home Safe 2.0 that serves homeless clients. It's expanded enormously, thank you to the state. And we're able to put this client into a hotel and wait until we can connect him to a board and care. So it's very exciting. It's a very exciting opportunity to use the ones that are existing for our homeless or at-risk clients, but most exciting would be to open those specifically dedicated. It's always been my dream to have permanent supportive housing for older adults that is like an assisted living, where it's more support. So I think it would be a brilliant idea.
Great. And it's kind of like the hotel motel, and that it was COVID that helped us figure out, because we were, you know, just utilizing one-offs, so to speak, in the families. And it was, you know, that just was the place that we could send someone, and it wasn't always the best place. But during COVID, be able to make them room key, as I mentioned earlier, was really a great way to bring people together, as well as I think we found encampments, for example, oftentimes a limitation in getting someone to leave an encampment is their friends, their support system. I think about it too. Do I want to be in a place by myself, or would I have someone who protects me here? And, is my family, my animal, whatever it may be. And I think we saw when you could say, okay, 10 of you can come together to this one hotel, they more often than not would go, not only because of that friendship, but similarly the design and why it goes to the board and care, which is you had your own bathroom and you could close your door. That's why tiny homes, albeit I was a little apprehensive about some of those, but it ends up people say, you know what, I can close my door. And that is more important to me than anything. I feel safer in that environment. And in that instance, you don't have the bathroom right there, but you have it right across the way that's designed, et cetera. So I think there's some opportunities there, and big on the board and care. One of the questions that was also asked that I think Nancy received was about the ending of the eviction moratorium that is coming up or has happened. I can't remember the date, and what impact you believe that might have on homelessness. Anyone want to jump on that? Whether I would say Carter or Amy probably would know most. Carter?
I mean, it's not going to be not going to be great in terms of I think we've been delaying an inevitable outcome. Fortunately, I think one of the things that the homeless system, the bank account and the homeless system that would normally have been paying rental arrears has been able to save up some funds over the course of the pandemic, because evictions have not been happening as much. And so I think the good news is that I think the homeless system has a small cushion to respond to evictions that might be headed our way. I'm hoping it's not a tsunami of evictions that overwhelms our ability to respond to them. But this is anything that is going to impact housing stability for extremely poor people is going to impact homelessness. Those are our folks. And so, yeah, we're all nervous.
Yeah, nervous.
Yeah.
I'm going to go back to my high acuity question, because this is something that, again, gets debated a lot. So if I'm going to be the lay person here and try to explain it. So for several years, it was, of course, we don't have enough resources for everybody. So you have to make choices. You have to have priorities. And at the time, a decision was made that we should look at those that are the most vulnerable. So they have the highest acuity, which meant some people, who maybe if you just helped them when they first came into homelessness, you might be able to get them on their way back, but we couldn't do that because we only had so many resources. From your perspective, and I would ask all of you, I think there's been some change in how we're looking at it, and some flexibility in that acuity, that SVDAT, whatever that sounds for, but it is the way in which we look at someone's acuity. Maybe you guys could address that and educate our participants as to what that means and how we're going in the future.
I feel like I've been talking a lot, but I work on this project, so I feel like this one's I'll take first shot. So the VSPDAT is used across the country. It's a vulnerability index that most continuums of care use. And this is actually a perfect example of where I think LA can be at the forefront of something. I just went to the National Alliance conference, and we are certainly the jurisdiction that is saying, let's look at how we measure vulnerability. Let's look at it from an academic standpoint, but with an equity lens, which means let's partner with actual data science professionals who are not just educated in homeless services, but actually understand how assessments work and are scored and what they mean. But let's pair those academic partners with people with expertise, people who have administered these assessment tools, people who have been on the receiving end of these assessment tools. Let's particularly talk to Black and African-American residents, because the hypothesis was that the assessment that we use across the country undervalues the risk that Black and African-American individuals face, and might overvalue, in relative comparison, white vulnerability. And so what we did is we put together an academic project that paired the researchers with those people with expertise and community advisory boards to understand what are we asking, how are we asking it, how should we ask those very sensitive and intrusive questions. And then the data science team looked at how do the answers to those questions actually relate to vulnerability that we can measure in data, meaning vulnerability to you, Wendy, might mean something different than to Jean or to Amy or to me. And so what the data science team said is, well, let's define it. And let's define it in a way that we can measure. And so the data science team basically has recommended to LASA that we define vulnerability in ways that the county has the ability to collect and measure around risk of hospitalization, risk of death, risk of arrest, risk of being placed on a 4150 hold. I might not be getting all those exactly right. And then let's only ask the questions that are actually predictive of those outcomes. And let's only ask those questions in a way that is trauma informed. And so we've done that. We've studied it now, and we've done it in a way that I think are better than any other community in the country. Now the question is, how will we go from studying it and designing it to implementing it? And that's really where we are. That's why I say we're at the where we can be at the forefront if we implement it well. And I think that's the open question for all of us is, how do we partner with LASA and these research teams to take a good idea and a really great project and then think through how it will get implemented, how will it get explained, how will people be trained on it? So I have a lot of hope for the revised assessment, but I also have some cautious skepticism about it.
Well, and I think it is important because, you know, in the political landscape, and again, we've all been in front of a council member or supervisor, whomever, like saying, you know, how come this isn't solved? How come we can't do it tomorrow? How come what you did didn't work? Whatever the case may be. And you sense their frustration and it's coming from a good place. However, I think the one thing that I feel I have learned too, and all of you, is like, you know, you got to try something and it may not work and then you pivot. That doesn't mean what you tried wasn't important to try to figure out that's not the way to do it. But I think it's really important that we recognize that each individual is different. You know, each person has their story. There is no, you know, when someone has a broad brush of, you know, they're all mentally ill, or they're all, you know, drugs, or they're whatever the case may be, that those that are discriminatory in the way they describe it do not understand that historical nature of which and what that person may or may not have gone through. And I was hearing a story today of someone who came to a shower program, was in her early 20s, deaf, clearly had not had education, had no documentation, nothing, you know, and here's an individual that you just want to be able to say, okay, let me put you right here so I can get you everything you need right away. And it's just not that easy, but I think it goes back to the housing first model. Jean, one of the questions, and this maybe some of you can answer as well, was related to training of ICMs. I'm not sure that you know, getting more people who are being trained to work with the elderly, you know, and older adults. Do we feel there's enough, you know, training that may or may not be happening in that area? And I think the second part of that question, you know, is, you know, the complexity of the needs that they write in here, of from cognition to psychiatric to chronic physical needs, very different than the needs of a younger population. As you alluded to, you age much quicker on the streets. But do you think there's enough individuals who are focusing, even though it sounds like we're having trouble generally getting people to go into this space of working on homelessness? Can you give us a little flavor on the parts that we're dealing with the elderly or older adults?
Sure. And I'm glad the person who asked the question noted cognition, because as we know, aging is positively correlated with dementia. And sorry about the background noise. But yeah, so DHS runs the ICMS program, and it would be my belief that they are very well trained. Their intensive case management system, but who isn't well trained? And something we're really, really focused on, and as is the state, training in-home supportive service providers, IHSS providers. So as you've noted, that our homeless clients or in some of the at-risk, they're going to have specific needs, just aging needs, and of course those who have experienced homelessness, all the trauma and what that's done to their physical and their bodies. And an IHSS worker has only one training, and that's how to fill out a timesheet. So right, well, you know, oftentimes it's like the daughter or the cousin, you know, I could help my mom in and out of the shower, and whatnot. I wouldn't really need to, although in her case, I would have loved some training around dementia, but safe transfers and all of these, they're just not trained. But luckily, the state is acknowledging this and is in their proposed funding or past funding that is coming down the pipeline. There's a lot of money to train IHSS workers and to be able to elevate them and for them to earn a little bit more money with specific training. And that's with the goal of two things. One, drawing more workers to the field because there's a massive shortage. And two, having them more trained up. Now, it's one of the projects that I'm involved with in a group is to try to get training to IHSS workers that's specific to older adults who have experienced homelessness, which is also just different than older adults who are aging. So we're working on getting some training together. We've got some organizations in Los Angeles who are to do that training. So yeah, our hope is to get more caregivers trained in how to best support these clients once we can get them in.
Great, thank you. Amy, one of the questions I think got raised too, which was, what are some of the unique challenges IPV survivors face? And as you're about ready to answer that question, anyone who would like to ask a question in addition to typing into the chat, Nancy Volper tells me that if you raise your hand, she might be able to unmute you. So I think we're scheduled for another about 15 minutes, but that's kind of where we are on timing. So go ahead, Amy.
Thanks, Wendy. Maybe I can try to make this a 2 for 2. So I saw someone asked, what can Jewish Family Services be doing more in your programs as well? Or I know what you're already doing too, and at this intersection. But survivors of violence, one of the components of violence usually is financial abuse. So they're coming with wrecked credit, no money, a little access to money. And we found great success in a model called Domestic Violence Housing First, which was created up in Seattle with some Gates Foundation money about 10 years ago, replicated now statewide in California through the California Office of Emergency Services, and now recently picked up by HUD, who's giving LA County and other across the nation some domestic violence bonus funds to use this model. And it's rapid rehousing, but more flexible. So it can be used as prevention because not all survivors need to flee into a secluded shelter. Some might not be facing the lethality fears or, have a way to stay somewhat safe from abuse and do not actually need to go seclude into shelter. Some perhaps could stay in place, and this model helps you pay for the things that would lift any barriers for that to happen. So there's more flexibility with paying for childcare, paying for car repairs, paying for some debt that might be getting in the way, credit repair, education programs, outfits for employment, really flexible. So exciting to see that model grow and more funding in that way. In the listening sessions that I mentioned before, the level of trauma, like just how things are so on the surface of people, just like what women are dealing with every single day and how close to the surface their trauma is, and just recognizing that, to Carter's point, making sure that our assessment tools aren't re-triggering and re-traumatizing. We as service providers have we can replicate the power and control issues so fastly. It's really incumbent on us to make sure that all of our practices, all of our programs are doing everything possible to not re-traumatize people while we're trying to help them at the same time. So yeah, that's some of the issues that we're seeing domestic violence survivors bring up.
So one of the questions I always like to ask, and I ask it of others, so I don't have to answer this question, but if you had a magic wand, magic wand that you could do one thing that would just help in all of your work, that would just, you'd have a whole heavy lifting, what would it be? Or one thing that you think municipalities should do, or state government or whatever, just kind of like, and you could say more than one, I'll let you do that, but a magic wand. And Amy, you just spoke, so I'm gonna go to Carter on this one. other than passing your legislation today.
Yeah, other than housing.
Yeah, exactly. Could,
Other than affordable housing.
yeah.
No, I think for me, it's, I wish that we let how we pay for it not define how the person has to access help. I really, and I've seen, it's not just LA, everywhere I've ever worked, we make it way too hard to go from you're in crisis to you've had help. Actually, I had this really beautiful moment. I used to work for FEMA, and FEMA was actually good at this. I went to a disaster. I got in the I just checked into my hotel. I got in the elevator, and one of the survivors of the disaster was in the elevator with me. And we've been trained not to ask how you are. So I said, I hope you're getting what you need from FEMA. And if there's anything I can do to help, let me know. And she said, I already have my money. And the disaster had happened only 2 days before. And that's not how we treat people who are homeless. You've got to go through an assessment. You've got to be in a shelter for 90 days. You've got to go through this. You've got to apply for that. You got to apply there and there. And I just wish that we would treat people who are in crisis, especially humanitarian crisis, that we know we're part of creating. I wish we just gave them help and made it easier, and let how we pay for it not be how they experience getting the help.
Oof. I'm with you. That magic wand, I'm going to work towards getting that magic wand for that, because that is so true. And during crisis, and we've all talked about, do you declare an emergency, what it is, to be able to do that. And again, we moved mountains during COVID. We moved mountains when I was working for HUD during the earthquake, the 1994 earthquake. We got Section 8 vouchers out in seconds. We got the PPP loans for businesses, immediately, it was like, wait, these are people, both are people. That I'm with you. So count me in on that magic wand. All right, Jean, I'm going to go to you on your magic
I'm
wand.
going to make them very short, because I know one, I would really love well, first of all, I'd like to acknowledge that under these disasters that we're talking about, both pandemic and natural disasters, older adults are vastly overrepresented in the harm. But I have three things. One, the drivers that drive older adults into homelessness, I wish they would be addressed. I wish their cost of living increase every year was not based on the workers' CPI. It would be based on what older adults spend their money on, which is about 50% more on health. And I wish that they didn't have to spend so much out of pocket. And I know the Inflation Reduction Act is going to help that. That's in 2025. But those major drivers that LAHSA can't fix, they can blame LAHSA, but LAHSA cannot fix these main drivers, but they could be fixed, and it would be truly extraordinary and better for humanity and less expensive in the end. Secondly, a very minuscule thing that I would love to be fixed is the assisted living waiver should be available immediately to older adults who are homeless or at risk.
And what does that mean? Yeah, what does that mean?
The assisted living waiver can take 1 to 2 years to get. We're not talking about, these are people who need assistance and not to wait for it for 1 to 2 years. Okay, so there is an expedited process to get an assisted living waiver, and that's if the client is in the APS system, which is wonderful. They shouldn't have to be in the APS system. We know they are the most vulnerable. We don't need a VI SPDAT. We don't need a 555. We know most of them are living with disability, including the need for support with activities of daily living. We know most of them are living with multiple chronic conditions, and a lot of our older adult clients are living with cognitive impairment. They should be streamlined in to get an assisted living waiver, so then they could be popped right into those board and cares that we were talking about earlier. And lastly, you already told one of my dreams, and that is to have homeless housing that is like an assisted living, where older adults who are homeless have services and supports up to the highest level in their housing.
Great. And Jean, I'm going to make you tell me how I can make that assisted living waiver happen faster, whatever legislatively. I like challenges. So I'm going to use
and I would love you forever.
Okay, there you go. That's my goal, Jean. Okay, Amy.
I wish that we could stop swinging the pendulum back and forth and like stick on a train of evidence-based practices. Housing first, trauma-informed care, harm reduction, keep our eyes on the prize with permanent housing solutions, finding, with the right mix of emergency and transitional or whatever, however you want to label shelter behind that, but just like stay on it. It's been my biggest, the area that I feel like I burn out in is when a politician changes the way. When we've been like, no, there's evidence behind this, there's evidence behind this, there's evidence behind this. So
Great. Well, that's a big task to get, as a recovering politician, to get us to focus on the, what works. But I agree with you. So I want to just in our kind of each to have you have some closing remarks, but part of what I want you to be able to say, each of our panelists, is, we have this wonderful JFS who has been, a leader in the community, has stepped up when there's been a need, kind of no fanfare, just has donors and supporters who step up and say, we're going to do this. And that is a wonderful resource for this community, and not just obviously to the Jewish community, but beyond. And that is heaven sent, I think, to all of us. So a big thank you to all of you that are here and the leaders for doing that. But some of the questions have been, of course, what can they do? And that is a common question, not only just JFS as an organization, but as individuals. If they wake up tomorrow morning and say, I was so inspired by this panel and what I'm going to do, this is how I can help. Obviously, always financial resources support the organizations that are doing the work, but ways in which we think that people can advocate, et cetera, just a few things. So I'm going to go back around to you, Carter. I'm going to go back to the beginning. And Carter, if you could just kind of a few kind of closing comments, and then secondly, what would you do to challenge people to go to that next step?
Okay, I got my actions, but let me start with my closing thought. My closing thought, working in the sector is brutal, and people often ask, when I go to house parties, I don't like to talk about what I do because I don't want to hear everybody's opinion of homelessness. And then you wake up and read the paper, and it makes you feel like you're a failure. So what I would say is that I have hope, and I have hope because of people on this call, organizations like you all. Every day I get to be in partnership with people who are literally just rolling up their sleeves, ignoring the politicians who keep changing their minds, and keep doing the evidence-based work in partnership with people and society that we have decided are just members of an other class. And I think the heroes that I get to partner with are the reason I have a lot of hope about this. I think that I am not burnout, I am inspired, and I just want people to know that, because I think there's a perception that we're all 1 second away from quitting, and I some days I feel that way, but not today. What you can do today is you can contact your state senator and tell them we need one more vote to pass SB 679, which would create a local affordable housing solutions agency in Los Angeles County, and we are one vote away. So before midnight, call your state senator, tell them to vote yes. What you can do. It's not too late.
It is not too late. They're literally voting till midnight. So, but do it soon. Okay.
What you can do long term, I'm actually posting in the chat. Thank you to Jean, who partnered with us on creating the older adult strategy for LA County. I'm posting the English version of that in the chat. And then my breaking news is that you're the very first people who are also going to get a copy of the Spanish language version, which took too long to produce, but it is there. And so both of those are available, and those documents tell you explicitly, as an organization or a system leader, what can you do to help older adult homelessness in LA County. So, and a lot of that is thanks to Jean's brilliance. So thank you, Jean.
Thank you. All right, Jean, that's going to go to you now. You're muted. Yeah, go ahead, Jean.
I do love collaborating with organizations, and United Way has been just extraordinary. They also have someone dedicated to older adults, which is really. Jewish Family Services has been amazing. They're an extraordinary organization that does so much for so many people that I'm just in awe of them all. Anytime am interacting with someone from there, I'm just like, you guys are so fabulous. And I work with a lot of fabulous people, but it's really extraordinary. They're very, very dedicated. I know that they're working. They know all of our prevention programs. We've met, we've discussed it. They join in on our multidisciplinary cross-sectoral convenings that kind of bust down silos so that we can all talk to each other about older adults at risk of or currently homeless. They're amazing that way. And I think if I were to like pick one thing to have them help with, because they already do so much, it feels almost greedy, but would be, I know they're dedicated to supporting caregivers and educating caregivers. So we need our IHSS caregivers supported and educated. It's already starting to happen, but if they want to jump in on that train, it would be fantastic. So I think that's what I'd say.
Thanks, Jean. Amy.
So I told you my burnout area, but my area of rejuvenation is just being in direct service to who we work with and having the proximity to so many amazing women who teach me every day and fill my cup. So I hope you have proximity to who you serve too. And in my internship here at Jewish Family Service, I listened to voicemails that people who called the general line, and I triaged their calls and I called them back. And I always had a resource that I could give them that Jewish Family Service was already doing. So I guess my advice to you all is keep doing what you were doing. The free therapy, prevention money, the loans, the support for families. I don't know. I just remember those phone calls and I remember being like, oh, I always have something I can offer. And then a selfish call to action is we need 200 volunteers to go out and survey 700 women for our women's needs assessment, and we are looking for volunteers. So I will send Nancy the link to sign up as a volunteer, and you can send that out through your network. That'd be really helpful.
And Amy, when are you doing that? So if people
we are doing it, the training, there's 5 training dates in October, and we'll go out at the end of October and through November. It's a huge, what LAFSA does the survey countywide. We're embarking on a huge private endeavor that is supported by the Board of Supervisors, Supervisor Solis in particular.
Great. Well, make sure you send to me too, and I'm going to send to my friends to make sure that they can do that too, because that would be fabulous. I would enjoy it. Well, I think this was you, Carter, that said heroes. That there are a lot of heroes out there, and it is awfully a thankless task to serve the most vulnerable, but in many ways the most rewarding. As you said, Amy, and the people that you meet and you see and you help. And so I just want to thank you. It was my honor and privilege to serve as moderator today with 3 incredible panelists who I respect a lot, and particularly again to JFS for being so fabulous. And I thought it was really a great panel. And I know if you have other questions, Nancy will make sure to find me to see where we can be helpful. But thank you so very much. And I think I'm sending it over to Sylvia, I think, or somebody. But thank you so much for having us all. Bye-bye, everybody. Thank you.
Okay, thank you, Wendy. Hi, everyone, and many thanks to our guest presenters today. We've really heard quite a bit to become a little bit more grounded in the larger scope of homeless services, and we're going to talk just a little bit about the services that JFS provides sort of in this sector. So our programs at JFS don't specifically target the population of our unhoused community members. However, in many, if not most of our programs that run the spectrum from early childhood services all the way to older adult services, we do encounter many individuals every day that are marginally living financially and just on the edge of potentially losing housing, or on the verge of eviction due to mental health issues, domestic violence issues, physical or medical conditions that are really putting their housing on the line. So our service delivery is really more in the realm of homeless prevention. And for our final presentation, we do have a panel of 4 of our senior staff members who will talk a little bit about what our JFS services provide within a few of these programs. So I'd like to introduce our panel who's going to take it from here. We have Karen Rosenthal, Senior Director of Child and Family Services for JFS, Jessica Barton Brimley, Director of our Homeless Prevention Program for Adults with Hoarding Disorder, Jen Glazer, Director of Central Access and Ezra Network Programs, and Steve Barlam, Chief Executive Officer for JFS Care. So I will pop it on over to Karen.
Okay, thank you, Sylvia. Good afternoon, everyone. I'm really so happy to be here and tell you a little bit about our attempt in prevention services. So just a very quick history. HOPE, which was originally called Family Violence Project, for those of you that did not know that, opened in 1987 as a very small counseling center. It was born out of a master's thesis, believe it or not, on domestic violence in the Jewish community. And then in 1995, we received our first state grant to open a shelter, and we have been growing ever since. So our funding, we have multiple funding sources. We have with LASA, which you just heard Jean speak of, and the State of California Office of Emergency Services. We have funding from the Office of Women's Health, and then also from the City of LA Community Investment for Families. So we really go from federal all the way down to city. Our target population are victims of domestic violence and their children, regardless of race, ethnicity, religion, sexual orientation. We see everyone and anyone. So some of our homeless prevention services include, we have 2 30 to 40-day emergency domestic violence shelters and 1 long-term transitional housing shelter, which a family can stay up to 2 years. In 2021-22, the shelters housed 392 persons. That's 122 adults and 270 children. So to me, that translates into 122 families that were prevented from being homeless after leaving their partners. 270 children had a roof over their heads, food and necessities provided, in addition to everyone getting therapeutic services and emotional support. We provide, some of the services we provide are individual and group counseling, case management, social service and legal advocacy. We have groups on life skill development, parenting education, employment and housing placement assistance, and children's programming. Our services take place directly on site, so they take place within the shelters and at our 2 counseling centers, one at the Valley Storefront in North Hollywood and the other at the Pico Robertson Center. All of our services, by the way, are voluntary, of course, strongly encouraged, and all are trauma-informed and client-centered. And what that means is that each person or family receives a plan for their future based on their needs and their wants. Each family determines their own goals for future safe and stable housing. Excuse me. One of the concrete prevention services that we started last year, we received a grant from the city. It's called Survivors First Grant. It provides flexible funding to clients, those in shelter and at our counseling center at both sites. Assistance is to prevent homelessness by offering rental assistance for up to 6 months. We offer first and last month rent deposits and any moving costs. And in addition, we provided financial assistance with utility arrears, legal fees related to evictions, and even funds for emergency food and clothing. Currently, we're able to provide up to $8,000 per family. This past year, which was the first year that we had the grant, the first year that the grant was in operation, we helped 58 households, that's 58 adults and 90 children, and we gave over $365,000 to prevent homelessness. Hopefully this year, with additional funding, we will assist at least 15 to 20 additional families. So in closing, the goals of our program, our shelter goals are always exits to safe and stable housing. For everybody, our goal is to increase their knowledge of community resources so they know where to go and who to reach out to, and of course, for family safety planning. For everyone, again, we hope that they move toward independence and violence-free living, to break the cycle of domestic violence, and to reduce the risk of homelessness. So hopefully that gives you a snapshot of what we are doing to prevent homelessness in the LA community. So I will now hand it over to Jessica. Are you next?
Thank you, Karen.
There you go.
Presentation. All right, so I am Jessica Barton Grimley. I'm the director of the Homeless Prevention Program here at JFS. And the program, so again, this is just going to be a very brief overview of the program. The program began in May 2021, and we launched and began enrolling folks into the program in October of last year. The population that we are targeting is includes older adults that are age 55 and up. They are living with a mental health disorder. They are at risk of eviction due to hoarding, extreme hoarding behaviors or hoarding disorder, or they have recently become homeless. We have not yet served any folks that were referred to us as a result of becoming homeless due to hoarding disorder. So as of right now, we have served folks that are at risk of becoming homeless due to hoarding disorder. That means that we may work with, and we often work with folks that also have co-occurring disorders. That may include substance use, that may include depression, that may include OCD, bipolar, etc. So we do not discriminate based on any types of other disorders that folks are living with in addition to hoarding disorder. And then just to give a brief overview of hoarding disorder. So what that is it's the acquisition of and inability to discard items regardless of their perceived value. That is characterized by excessive collecting and saving behaviors, resulting in cluttered living spaces, which causes significant distress and impairment in daily functioning. So what that means, just to break down cluttered living spaces, that means that folks are not able to use their living areas for their intended purposes. For example, in a kitchen, if there's a dining room table, it is not able to be utilized due to the amount of clutter or items that are on top of the table. It could be in the living room with the coffee table, it being so cluttered that they don't have access to that, or the couch or sofa being so cluttered that they are not able to utilize that space for its intended purpose. Same thing applies to all of the rooms, bathroom. We have encountered folks that are not able to take care of some of their hygiene needs because their bathtub is filled with their belongings. So that is restricting their space. They're not able to utilize it for its intended purpose. And then just to go over some of the specific diagnostic criteria, what that looks like for hoarding disorder is they are excessively acquiring and accumulating objects, again, which I just reviewed. They, folks with hoarding disorder often have a lot of, or experience a lot of distress when they are discarding items. So that is clinically significant, or it causes clinically significant distress or anxiety when they do discard items. Again, there's functional issues due to loss of space, social isolation, family discord, financial difficulties, health and cleanliness issues. There is often an inability to maintain a safe environment for themselves and for others. And that is often, excuse me, the reason why we receive referrals, because there is imminent safety concerns and they are referred to our program so that we can assist. And again, also, it is something that we would have to rule out there not being, or these behaviors not being associated with any other mental health condition or chronic health condition. So all of these behaviors would be related to hoarding disorder versus another mental illness, or better explained by another mental illness or a chronic health condition. And in terms of the services that our program offers, so we do provide mental health counseling. We provide intensive case management and concrete assistance. So folks that are enrolled into our program, they have a team. There's one clinician that would be working with the client, as well as one case manager, social worker one. And as a team, they would be working with the clients that are on their caseload, providing mental health support, providing intensive case management, linking them to services to address any barriers that they might be experiencing. Also providing life skills trainings. We're often encountering folks that are really struggling with organizing. So we will go through, create an organizing plan. So that's what our team will do once they are enrolled into the program. And then in terms of concrete services, what that looks like is heavy cleaning and organizing. So once our clients have reached the point where they are ready for heavy clean out services, then we will contact one of our vendors and, based on their availability, schedule something with the vendor and the client in order to begin that process. We obviously want to go at the pace of our clients because we recognize that they are all living with a mental illness, if not multiple. We also can provide assistance with storage and moving costs. And we do link to legal assistance or legal aid in order to prevent the eviction from going through. So oftentimes, if somebody is already in the eviction process, they are being referred with already receiving legal assistance. But if they are not already receiving legal assistance, then we will link them to services. And our overall program goals, being that it is a homeless prevention program, is to have our clients maintain or retain their housing, not become homeless due to the conditions of their home, and also to improve their quality of life. So decrease the symptoms, specifically of hoarding disorder. And that is just a very brief overview of our program. And I believe who is next is Jen.
Yeah.
So I'll pass that over to Jen.
Thank you. Hi, everyone. I'm going to talk about two programs today, Central Access and Ezra Network. They're combined, but I'll start with Central Access. So Central Access was established in 2008. The main funding source is the Federation, the Jewish Federation, and our own fundraising. So we respond to the calls on the intake line. Anyone calling JFS, we have one place for people to start, and that is often people who are dealing with housing insecurity, financial needs, and we are helping them navigate the many resources. And you can hear from before, it's a complex web of services. People don't know where to start often. And then I think where we're the most impactful is at both of the SOVA sites. We have social workers on site at both our Valley and our Pico location. And it's pretty unusual to have a walk-in service center where you can just meet with a social worker and ask questions. And we see people who are unhoused and also who are housing insecure. We provide guidance about navigating the lead agencies that are doing this work, safe parking. Many of you might be familiar with a place people can safely park their car in LA and get other services. There's been times where we might secure a spot at a safe parking lot for somebody. Legal assistance, a lot of shared housing options. So we are helping people navigate those resources. And we have a small caseload there. The team is a team of 4, so it's 2 at each location, 2 social workers, 1 master's level and 1 bachelor's level. We did find that it is challenging to help people navigate these systems. And so we were able to do some outreach and engage some community providers at both locations, LA Family Housing in the Valley, and we've had a more consistent relationship with PATH at Pico, both before the pandemic, and PATH was able to come back and be on site at SOVA Pico. So we find, and I think this is an area to continue to try to develop, to have providers on site, particularly in this space, is very helpful, and people can go and see that caseworker and really educating people about what's available. And right now, unfortunately, PATH is on hold due to staffing issues, which came up in the prior part of the talk. In terms of concrete assistance, we have a wonderful JFS donor housing fund, and that is available not just to central access clients, but JFS clients agency-wide to promote housing stability and homeless prevention. So that is the concrete assistance through central access. So I think that's sort of an overview of the services through central access. In terms of Ezra Network, this is a Jewish community program doing counseling and community case management. It is part of a network of services offering coordinated care through JFS doing the social work piece, Beit Tzedek doing the legal work, and JVS SoCal doing employment, working as a team. Similarly, people reach out, they have a number, and it's anyone in LA County in the Jewish community. So any type of social service need. Again, the case management work is a lot of financial challenges, employment, sometimes it's caregiver needs. And our current caseload of case management clients, over 50% are either completely without housing, which is a much smaller portion, or housing insecure. They've received an eviction notice, they're behind in their rent. So we are working with this group of clients, connecting with others in this space. We do see many people are looking maybe for the first time in their lives at shared housing, getting a roommate. There's also other agencies that work with shared housing opportunities. Our caseworkers, our social workers are working to develop a sustainable plan, collaborate with providers, and we have grant funds available through the Federation and also our donor fund. But grant funds are available, but the challenge is finding that sustainable situation. The grant funds aren't available to keep someone going permanently. So they're a great tool. And so our mission is really to ensure people, whatever program it is, have the maximum access to the help that they need within the network of services here at JFS or in the community. Okay, I think that's a little snapshot of both, I hope. And I think Steve is next.
Steve, you're muted.
Thank you. Yeah. And thank you so much, Jen. It's good to see all my colleagues here. I want to talk to you about a program that we call CHI, Caregiver Homeless Initiative Program. It was funded a year ago, a little over a year ago, at the beginning of July of 2021 by Cedar Sinai Foundation. Really putting money aside to see if they could impact and help people stay housed. So you see a lot of the words in front of you that's on the screen. I'm going to go a little bit away from that, but I'm going to give you a sense of what we do, why we do, how we do, and what's it all about and what our goals are. So the why we do what we do, it's really our entire team is driven to create better care experiences for our clients who have very unique and complex needs. We know that those who have experienced chronic housing often have complex issues that they're facing. We believe having an experienced professional care manager involved really helps ensure that clients get the care they need. And we believe that when people get consistent care and when it's put in place to meet their basic needs, they tend to thrive. Now, as Jean said, the population that we're working with, when we talk about older adults, it's really the 50+ population. And she had mentioned how there's about a 10-year accelerating factor in being on the streets. So let me tell you, we have enrolled 91 people in the program. We have gotten 91 referrals. We have done 91 assessments. We have only served out of that about 42 of those clients because of complicating factors. And we have 12 now who are currently in our pipeline. So how do we work? We provide care managed care. That means having a caregiver for these clients who have been recently homeless. But we have a care manager involved who is an experienced professional to focus on the home care aspect of their needs and to help ensure that the caregiving goes as smoothly as possible. As our panel before had spoken about the complexity of this population with a multiplicity of needs, from physical chronic needs, cognitive needs, psychological personality issues. It's like an onion that you're peeling the skin away at, layer by layer by layer. Just such a complex population. And how we work that leads us to success is that we are so persistent in how we communicate with all involved to advocate for our clients and advocate for our caregivers. So what do? We literally provide practical care to assist clients with bathing, dressing, toileting, transferring, ambulating, feeding, socializing, housekeeping, laundry, medication reminders, and escorting folks to errands. And we provide oversight of that care by that professional care manager to ensure that the caregivers and clients alike get the support they need and that communication flows between all involved, keeping everybody safe and secure. So the goals in mind, the bottom line is we want clients to feel supported. We want clients to stay housed. We want clients to get the care they need. And we want our clients to avoid needless hospitalizations and ER visits due to somebody there to help with medications and appointments. And I just want to share with you something just very quickly. I just got an email this afternoon from one of the professionals involved who sent me an email, and I'm just looking for it right now. There we go. Jewish Family Service. A big thank you to you guys for providing accessible, no cost, and culturally responsive caregiving. Prior to receiving services with JFS, my client and I were navigating resources and were met with many barriers to eligibility. We have provided, just as an aside, a Spanish-speaking caregiver for this undocumented individual who was having a difficult time finding any kind of care. Without JFS caregiving services, our client would not have been able to maintain independent living. This was incredibly important for our client to maintain a space of her own. The most appreciative part of this experience, aside from the caregiving, is how intentional and thoughtful the team was in matching our client to a caregiver, and boy, did it pay off. Our client and caregiver work well together. A big shout out to Tammy, who has been central in addressing our clients' day-to-day needs. Overall, I'm incredibly grateful to support our client alongside Jewish Family Services. Their impact on her is remarkable. Thank you, Mariana Curiel, who is another care manager involved. And with that, I just want to say thank you. It's really been a pleasure for us to stretch ourselves within our JFS care to serve a new population, truly make a difference, and it's been so rewarding. Back to Sylvia.
Back to Eli.
Oh, well, we have some time for some questions. If there are any questions for our staff panelists.
And if attendees raise their hands, we can unmute you to ask questions if you don't want to type them. Eli, I'm not seeing any questions in the chat or on the Q&A.
Okay. I think we can then move forward to wrap up. Thank you. Well, I've got a whole bunch of notes. I don't know if others do as well, but this has really been an incredible couple of hours of information and also inspiration, to tell you the truth. It's really been wonderful to bring all of this information together. I do want to say the work that we're doing at JFS, we are not a formal homeless services provider, but we are in so many ways. And I think that we have opportunities to expand the work that we're doing, to deepen the work that we're doing, which is critical. Every single individual and family that is prevented from being homeless, every single individual and family who is restored to stable housing it's a life saved, and it's something that we should be very proud of. I do want to thank all of you for participating on the panel and also as our participants. This is the beginning of conversations. How do we at JFS really use our strengths to make the biggest impact that we can in addressing the most important crisis that Los Angeles is facing, which is our homelessness crisis. So with that, I do want to thank all of you for joining us and wish everyone a great rest of the day. Thank you.